if I was intent on damaging my own brain, what would you advise me to do?
So in the book, I talk about a mnemonic called Bright Minds. You want to keep your brain healthy or rescue it, you have to prevent or treat the 11 major risk factors that steal your mind. So if you want to damage your brain, Bright Minds. The B is for blood flow. Low blood flow is the number one brain imaging predictor of Alzheimer's disease.
Okay.
How do you get low blood flow? Caffeine,
Oh, shit.
nicotine, marijuana, alcohol, having a sedentary lifestyle, being overweight. The R is retirement and aging.
Can we pause on this low blood flow? You are the first person I've ever spoken to who has a comprehensive and very believable hypothesis that caffeine has a side effect. I've asked my guests over and over again because I think people refer to caffeine often as like this miracle drug that comes with no cost. But you're the first one through my research that seems to be very clear that caffeine does have a significant cost.
It's a drug. It's the most common drug. It's addictive. I mean, a little bit's fine, but more than a little bit is not fine. It increases cortisol. You don't want to increase cortisol. Puts fat around your belly. It shrinks your hippocampus. But, the reason I started really paying attention to it is on SPECT, the study I do, which is a blood flow study. It constricts blood flow 30%. I have all my patients hold caffeine the morning of their scans because I don't want it to artificially show me they have less blood flow than they really do. It fakes you out to think you have energy. What it does is it blocks adenosine, the chemical that tells you to go to sleep. And so often people rely on caffeine because they're sleep deprived, but it's just this bad cycle. And so many of my patients stop, and uniformly they tell me they feel better. They said their energy's better.
You talk about one particular patient in the book who was struggling with a variety of difficulties. I think it was like brain fog and memory issues and so on. And one of the things you advised him to do was to cut coffee.
Jeff, yeah.
Jeff.
I remember Jeff. He was a pilot, and I live on caffeine. I'm like, you got to get rid of it because his brain looked terrible.
His brain looked terrible?
His brain looked terrible. And he's like, no. And he's like, all right, I'm going to do it. And so he didn't get headaches. We cut it down by 5% a day. So 3 weeks it was gone. He didn't have any withdrawal, didn't have any headaches. And he's like texting me, unbelievable energy, unbelievable clarity. And it's a drug. And why, I want to teach my patients skills. I don't want them to just take pills. And caffeine's a drug.
Do you drink caffeine?
A little bit, not much.
How much was Jeff having?
Jeff was having about 600 milligrams a day.
Jesus.
Which is 2 venti Starbucks. 1 venti Starbucks is 330 milligrams of caffeine. And, we've supersized everything in this country. I don't know if they do that in the UK, but we certainly do it here. And it's not a good strategy.
And so long-term restriction of blood flow to the brain through these things you've described, caffeine, marijuana, all of these things, has a detrimental impact on the development of the brain. Pretty straightforward. I get that. So that's the B.
R is retirement and aging. You want to prematurely age your brain? Drop out of school. Do not engage in new learning. I mean, you doing this podcast, you're always learning new things, which is great for you. But the lack of, when you learn something new, your brain makes a new connection. When you stop learning or you start doing the same thing over and over again, your brain starts to disconnect itself. being in a job that does not require new learning is a risk factor for dementia. Being lonely is a risk factor for dementia. So be an ass, and you're more likely to hurt your brain. At my workplace, we have the no asshole rule. So there's a book by a Stanford professor called The No Asshole Rule. Love that book. And the no asshole rule as a CEO starts with me. So I don't get to be one, but I'm not tolerating anybody who has asshole behavior at work. And if you're not an asshole, you're less likely to be lonely. And loneliness is terrible for brain function. If you want to prematurely age your brain, eat a lot of red meat as if your iron and ferritin levels are high, because ferritin, which is stored iron, tends to age the brain. The eye is inflammation. If you want to increase inflammation, which is a root cause of so many medical and mental health issues, never floss. Don't really care about your teeth. So you want to love your brain, you have to love your mouth. It's absolutely critical for you not to have gum disease. Because if you have gingivitis, odds are you're at increased risk for heart disease and depression and dementia. It's fascinating. Like, I didn't learn about this, and I didn't really care about my teeth until I started seeing the links between gum disease and heart disease, gum disease and brain disease. And now I'm a flossing fool. But if you want to damage your brain, don't care about your mouth, about your teeth. Don't ever eat fish. People who have grilled or baked fish once a week have more gray matter in their brain. People who have low levels of omega-3 fatty acids have smaller brains. And if you want to damage your brain, eat the standard American diet. So processed food, like eat most of your calories from the gas station. Ugh. And from the fast food restaurants nearby. And they spend billions on getting those foods to the perfect crunchiness, the perfect meltiness, the perfect aroma, because they hire neuroscientists to addict your brain. Be suspicious. The G is genetics. You want to damage your brain? Blame everything on your genes. Like, I have obesity and heart disease in my family, but I'm not overweight. And I don't have heart disease. Why? I'm on an obesity, heart disease prevention program every day of my life. Because genes load the gun. It's what happens to us and what we choose to do that pulls the trigger. So I adopted my nieces because their parents couldn't stop using drugs. And I'm like adamant. If you want my help, you have to cooperate. There's no vaping. There's no drug use. There's no alcohol.